Okay, well, thanks so much for joining me today in an interview. I'm introducing Collin Stackhouse, who's on the Community Engagements and Communications team for the Governance Board, to learn a little bit about the work that you guys have been doing.
Yeah.
I was just wondering, can you tell me a little bit about your background and what drew you to the committee?
Yeah, so I have a background volunteering with Healthcare for All Oregon. Kind of got involved about 4 years ago when the pathway towards universal healthcare with the task force was explained to me, even though we're sort of still in the middle of this path now. The path was sort of obscured but did exist about 4 years ago, so I learned about it and got interested and started volunteering with Healthcare for All Oregon. I used that as part of my application to be a member of one of the committees. Every member of the committee applied and was approved by some of the members of the governance board. So that was one part of my background. I worked for a tech startup that focused on mental health and sort of data literacy and data sharing between mental health organizations. So I was part of that startup for a couple years, and I think that was another factor in my acceptance to be in the community engagement role. And I do a lot of the social media for our organization, and I mentioned that when I applied as well.
Okay, that's awesome. It sounds like you've been doing a lot of advocacy work for a long time. So
a couple years, yeah. I mean, I'm pretty mad. So
yeah. What are the big tasks you're working on in your committee in the next couple of months?
Yeah, so the committee has only been in existence for about 9 months, and we really only do the bulk of our work on these monthly meetings. And so I'm about to say what our big step is, and both me, you, maybe somebody listening would think that shouldn't you have done this already, but we haven't. So the big decision that we're actually doing later this week is furthering our style guide, is what our legislative policy analyst with the governance board has described it, but just sort of locking in as a whole team. So the governance board has 9 people. There's around 45 other of us on the community engagement committee, operations committee, all these other committees, locking in exactly what kind of language we want to use to describe this plan to Oregonians, including phrases like people in Oregon we shall decide soon. I believe either this Wednesday or a month from now, we're going to lock in, are we saying that this plan is for people in Oregon? Are we saying that this plan is for Oregonians? Are we saying that this plan is for residents of Oregon? Because those all mean different things to different people, right? The current sort of trajectory, based on some work, I think, from OHA and like some precedent that's already existing within the state of Oregon, is to use the phrasing people in Oregon, or people of Oregon, people in Oregon. So that's one of the decisions that we're working on soon. Our committee is a little funny in that we are pretty dependent on the plan that is made by the other 3 committees. So the Finance and Revenue Committee, Plan Design and Expenditures and Operations, they are working on all of the details of the plan while we are communicating those details out to people. So to a degree, we're just a little like antsy, ready to start talking, and we don't have the first iteration of the plan to start talking about yet.
That makes sense. And the first iteration of the plan, from what I understand, is supposed to come out at the end of the summer. Does that sound correct to you?
I haven't heard any more recent updates, but my last understanding from about 5-6 weeks ago is that they're still hoping to do it by June. We're almost at the end of June. It's I don't think going to happen.
Yeah.
So, but this summer, the first draft of the plan should exist. It must exist in time for next January, when our committee is obligated to do a lot more outreach to Oregonians. So we have to have something hopefully well before January.
What do you guys plan to do after you get that in January? Like, what is your big work that you have to do?
Fingers crossed, we're going to get our first draft of the plan in the summer. October, our committee needs to help develop these physical materials, I guess maybe 1-pagers specifically from the governance board to describe the plan. So we're working on physical printed materials by the fall. Last I heard was October, but that timeline might change. As far as a community engagement and communications committee, we have to do dedicated outreach to different affinity groups within the state. And so whether that's like a combination community engagement meeting, like public listening session, and a governance board meeting. I've heard sometimes the governance board talk about wanting to do like one big kind of meeting. But that was a couple months ago. I haven't heard any more things about that. But I have a feeling it's going to be a lot of hurry up and wait.
Can you tell me a little bit about what the committee has already accomplished so far? We can cut this part if you want.
That's fine. I mean, yeah, who cares? What has the Community Engagement and Communications Committee accomplished so far? We honestly have like started communicating pretty effectively in our different communities. So, and it was made pretty clear right off the bat that the official compensated, paid, contracted work of the governance board to communicate about this plan and this potential transition is not enough, right? So even like in October, November, December of last year, 2024, talking with the people in my committee about our outreach, it was made clear that we have to do this like this, or like you're doing as a volunteer leader in Portland. Like that kind of outreach about this plan is critical.
Interesting.
So we've done different things in our communities. There's a member of the Community Engagement Committee who helped lead Eugene's Healthcare Forum, their second annual healthcare forum. She was the MC, Jensina Hawkins. Other members of the governance board are speaking on our social media. I do our social media. Another former intern from HCAO does some social media for our organization. But individually, we're like ramping up in our communities about this. So that doesn't really answer like what we've done as a community, as a committee. It's sort of like answering what we're doing as individuals. But
no, that's okay. It's like boots on the ground type stuff. So
boots on the ground. I think a desire to start speaking about this yesterday is something that we all share. So we are very eager, and that information is relayed to the other board members and committee members because we must start talking about this.
Totally, and I think that's really exciting too. That you're saying like. By the fall, we're going to start having hard copies of documents to start circulating around. I think that will be really good information for people to understand the work that's actually being done too. So that's pretty exciting.
Yeah.
What do we know for sure from your committee that is going to happen?
What do we know for sure? We only know for sure the language of the bill, Senate Bill 1089, which created the governance board. So, and I don't have it memorized, but we, I believe, as a whole board, in as far as the community engagement side of things, the board is obligated by law to do a minimum of 10 public outreaches in whatever capacity that is, whether it's all on Zoom or if it's huge listening sessions or different things around the state. However they slice it out, they've got to do 10 of them, and we're facilitating that, or helping facilitate. And we also must do specific dedicated outreach to other stakeholders, so both insurance providers around the state, hospitals, clinics, patients, CCO leaders. Like we as a community engagement group have to help foster that official communication. But I think that leads into one of your next questions, actually.
So let me see what my next question is. What is still in question in the plan?
Oh, everything.
Everything.
Yeah, everything's in question still.
Okay.
But I think that some of what's not in question is the foundation that the board members have. None of them, could be wrong, but from my perspective, all of them want this. All of them know that this is necessary. All of them understand that our system that we have in place isn't actually a system. It's not a functioning, working way for healthcare to be. And so all of them know that. That's not really in question. The question is how, and then what. So
who are the contractors that your committee is working with?
So there are two main contractors that the Community Engagement and Communications Committee is hiring or choosing to engage with. There's Diana Bianco and there's Patty Wentz. They have different company names, I think, like I can't remember which one's like Patty Wentz Consulting, and Diana Bianco has a different name. But those are the two women Oregonians who have been hired to do this work, and they, from what I can remember and glean, because it's complex, they have two different roles. So Patty Wentz spoke at our annual meeting, the HCAO annual meeting last year, and she's sort of an expert on communications and some of the best ways that we can talk to people who right off the bat disagree with us, right? There's so much anger, and there's so many big feelings connected with our healthcare industry that it's pretty easy to have really heated conversations, and Patty Wentz is really good at sort of giving people the tools to communicate effectively about this plan. Awesome. So, and that is a contractor with the governance board who is directly connected to Amy Fellows, who's a governance board member and spoke at our annual meeting. She recommended Patty Wentz as like a communications expert. So that's one of our contractors. The other one is Diana Bianco, and Diana does, I'm pretty sure she's not just working with our committee. She has a focus more on the obligations of Senate Bill 1089. So she is the one who's making sure that we communicate correctly and effectively to the different stakeholders that are required, right? So part of my interest as a patient advocate and just as a person in Oregon who wants better healthcare, I want to make sure that we, HCAO and the governance board, reaches out to patients. Diana Bianco is focused on the legal obligations of the governance board to reach out to other kinds of stakeholders, not just patients.
Ah, okay, very interesting. And then what are you most excited for pertaining to the plan?
I'm excited to end the conversation about if something's covered or like, you know, this is maybe towards the end of my lifetime, you know, I'm a middle-aged person. so like towards the end of it, like 20 years from now, like the question of who is covered, that shouldn't factor into our lives anymore. The question of will losing my job change anything? No, it won't, because your healthcare is not connected to your job. The question of does the little old lady down the street have access to healthcare? Well, I know that she's got the same access that I have, and I know that mine is good. So I'm ready for us to stop talking about this because it's not a problem in most of the world.
Yeah. Well, I think that's the great thing about the plan that's being built is there's an exact timeline. And we know when the work will be done, and we know kind of when it'll hit the legislative session and all that. So it's exciting to know like there is going to be an end to the conversation, I think.
Oh.
I'm so glad that you were able to meet with me and do this interview. So
yeah.
Thank you so much.
My pleasure.
Beep.
And cut.